Welcome to Indian Anatomist. Individuals who wants to pursue career in medicine are welcome to check out YouTube channel, Indian Anatomist. Today's topic, Histology of fibrous cartilage, is a part of the Histology series. Fibrous cartilage is toughest cartilage among the three types. Fibrocartilage appears to be quite different from hyaline cartilage on ultrasound, due to the predominance of collagen fibers, which cause increased reflectivity, and produce a homogeneously hyperechoic texture. This is an extra point in this situation. Under the microscope, fibrocartilage is characterized by smaller, and fewer chondrocytes than the other two forms of cartilage. There is no cell nest, but rather, the chondrocytes are presented in single or unbroken rows of 2, 3 or 4 cells at a time. The lacuna is an empty spaces that are present in all type of cartilages. In fibrocartilage, each lacuna houses the single chondrocytes, and are aligned, parallel to the type 1 collagen fiber bundles or fascicles. Now, coming to the matrix. In fibrocartilage, matrix is heterogeneous, and contains both territorial and interstitial matrix. Type 1 collagen fibers, the thickest and toughest fibers, are predominantly seen, along with type 2 collagen fibers, giving fibrocartilage's dense and rough appearance. In this, hematoxylin and eosin stained fibrocartilage, showing the parallelly arranged collagen bundles. See the arrows, representing the bundles of collagens. In hyaline and elastic cartilages, the lacuna may contains maximum of 6 or 3, respectively. More than one chondrocytes in a lacuna, called cell nest. But in fibrocartilage, these clusters are not seen. Instead, the single lacuna with single chondrocytes are arranged sometimes in a row, called row of chondrocytes. Like hyaline and elastic cartilages, the fibrous cartilage also contains ground substance. One of the components that makes up the matrix. The other one is fibers. The ground substance is made of glycoaminoglycans, that is chondroitin sulfate, and keratin sulfate, and hyaluronic acid. The GS representing the ground substances. The perichondrium is completely absent in fibrous cartilage. This illustration representing the general features of cartilage. If perichondrium is persist, the chondrocytes develops both from appositional and interstitial growth. Due to the absence of perichondrium, the fibrocartilage formation solely relies on interstitial growth alone. Now, the identifying points of fibrous cartilage, under the microscope are 1. Heterogeneous matrix. 2. Thickest, type 1 collagen bundles are seen. 3. Single lacuna with single chondrocyte. 4. No cell nest, instead, a row of chondrocytes may present. And finally, number 5 is, perichondrium is absent. Finally, I am going to discuss about the examples of fibrous cartilage or fibrocartilage. 1. Intervertebral discs. 2. Meniscus of the knee joint. 3. Glenoidal end, acetabular labrum, end. 4 is, articular discs of wrist joint, temporomandibular and sternoclavicular joints. Dear medicos, thanks for watching. Please see the histology of hyaline and elastic cartilage from Indian Anatomist. The links are provided in the description box. Please like, comment, share and subscribe. Good day all.